Hi everyone, thank you so much for tuning into our genetic counseling FAQs video. My name is Sophia and I'm a college senior pursuing a career in genetic counseling. With me today are 3 genetic counselors from Brigham and Women's Hospital, Abby, Elizabeth, and Megan. They will share a little bit about themselves, genetic counseling as a profession, and what the process of training to become a genetic counselor looks like. This video is part of our Brigham and Women's Hospital Genetic Counseling Virtual and Career Day event. If you have any questions that we don't cover in this overview of the fields, we welcome you to ask them during our live virtual event on July 20th. Hi, Abby, Elizabeth, and Megan. To begin, it would be great if you could each introduce yourself, your role at Brigham and Women's, and a bit about your path to where you are now.
Thank you so much, Sophia.
Thanks, Sophia.
All right, well, so my name's Abby. I work at Brigham and Women's Hospital in the prenatal department, so Center for Fetal Medicine and Reproductive Genetics. I've been here for about a year now. I graduated a year ago from genetic counseling school. I had a bit of a longer path coming to the genetic counseling field. Prior to school, I actually worked at one of the biotech genetic testing laboratories in more of a billing and then account management capacity. Through those roles, I realized the utility of genetic counselors in both the industry setting as well as the clinical setting as well, and it really sparked me to apply. So here I am after that long journey and made my way to Brigham and Women's Hospital, really helping our patients in the prenatal space as well as the reproductive preconception space as well.
Awesome. So I'm Megan. I am also a genetic counselor in the prenatal and reproductive genetics program at Brigham and Women's Hospital. Much like Abby, I graduated about a year ago and have been working in this space since graduating grad school. I went to genetic counseling knowing that this was something that I wanted to do since high school, which I think is a unique probably experience. I don't know that it's something that many people have the chance to interface with. So with that in mind, I really geared my undergraduate degrees to gain experience both in biological sciences and psychology, and afterwards really did want to work for a couple of years prior to going to school. And I think that offered me some real world experience, some life experiences, and to really explore and interface with the field of genetic counseling before entering the profession. So I actually worked as a clinical research coordinator, working on rare disease trials, really focusing on drug development for conditions like tuberous sclerosis. We worked with P10 and Phelan-McDermid syndrome, and that allowed me both to explore the patient side of things, working with families, but also work with a great team of genetic counselors. So that's what I did prior. I really was interested in that patient side of things and ultimately ended up in the prenatal space after all my training.
Great. Well, I will mix things up a bit. I'm Elizabeth. I have been at Brigham and Women's Hospital for about 5 years, but also came here after graduating. So I went to the BU program and graduated 5 years ago, and I work in adult genetics at Brigham. So I see adult patients. It's a pretty wide mix otherwise of people who are coming for diagnostic purposes. So they have medical problems and are trying to figure out if there's an underlying genetic cause or component, or people who are coming for predictive or pre-symptomatic testing. So maybe they have a family history of a condition and want to learn more about risks to themselves and possibly children in the future. I also work on different research projects. I'm the program manager of Brigham Genomic Medicine, which is a research group here at Brigham that focuses on novel gene discovery and trying to solve or diagnose rare disease cases. And I'm also the site coordinator and genetic counselor for the Undiagnosed Diseases Network, which is a national study through the NIH. The Harvard site is one of 12 clinical sites across the country, and patients apply who have a complex personal history of medical problems and are coming to be evaluated and hopefully get a diagnosis through the work of the UDN. So my clinical clinical programs, again, or in adults, but that ranges from a pharmacogenomics clinic, endocrine genetics clinic, and then general genetics clinic. So see a range of different things there.
Great. Thank you guys so much for sharing. And it's great to see the different ways you can enter the fields and the different types of roles that you all have within the same institution. So to start off today with our questions, we're going to begin talking about genetic counseling as a profession. And then we're going to follow that by talking about the training of genetic counselors. So my first question would be, what makes genetic counseling stand out as a career option among other health professions?
Yeah, I think that's such a great question and a very important one when you're thinking of what profession you want to go into. So I would say that genetic counseling has such a unique combination of science as well as counseling skills that it utilizes multiple skill sets and makes you a really unique contributor in the healthcare team. In addition to that, I feel that it's really essential in any career path that you want to follow. You have genetic counseling in the traditional clinical setting, you have genetic counseling in the research setting, in the business setting. There's such a plethora of different capacities that genetic counselors can really mold themselves into. And I think that really fundamentally comes down to having this science background as well as having these really unique counseling skills. So when you're thinking from a clinical research scientific setting, genetics as a science is such an exploding part of medicine that your job never gets old. The science is changing so rapidly that it's so important for you to be really up to date and on the forefront of all of these changes to really help your patients, but also help the healthcare team as well. I know from just our capacity in our department, we're really leaned on to be those subject matter experts and really consulting for the many different healthcare providers we work with. On top of that, it's just exciting from a personal nerd, I guess, science perspective of how just fascinating genetics is and how much it is part of medicine, increasingly so in so many different facets, from the traditional prenatal cancer, adult to pharmacogenetics. There's so many different realms within a medical capacity. And then I would also say combining the genetics plus the counseling portion really gives you a unique impact for your patients. In so many instances of genetic information, genetic medicine, you're talking about really tough, difficult conversations that really that counseling ability too helps you best meet your patients where you're at, empower your patients, and just really makes you a great advocate for patient care. So I think it's this unique combination of genetics, counseling, working with patients, being in different capacities that makes it a great career option. With a lot of potential growth, I feel like we're only scratching the surface.
And I think too, I would highlight that your title may not always be genetic counselor, but you can still use those skills in such a transferable way, like Abby was saying. So we have project managers, we have people who have moved into insurance and are advocating for coverage of genetic tests by insurance companies and really using their clinical hat and clinical experience to say, this is indicated, or we would recommend doing this test instead based on XYZ. So, you're never just stuck. While the science is exploding, absolutely, you can really, move very fluidly between realms of your clinical hat or something that's more non-clinical, more non-traditional, and always come back. We can always come back to the clinical side of things too.
No, it's so true. And I think, Abby hit that nail on the head with genetics is really trickling into every area of healthcare, every area of science. So there's a lot of different roles, a lot of different settings that genetic counselors can work in. And I think education is one of the key aspects of our job that feels different than, I guess, some other maybe similar healthcare roles. So educating patients, and then, as Abby said, educating providers. We really are experts in our field, and I think take that with us in various settings, whether you're educating insurers or different businesses or clinicians or patients themselves. So one of the genetic counselors in our group used to be a teacher. I think that's definitely a skill that comes through. So definitely a lot of different cool aspects of our jobs.
Yeah. Wonderful. Thank you guys so much for sharing. To build off a little bit on what Elizabeth was just saying with the education piece and the advocacy piece, this question could go to any of you. What might patients take away from genetic counseling appointments?
That's a great question. So I think for a lot of us, maybe we haven't sat on the other side of the table and, received that kind of counseling and interactive experience with specifically a genetic counselor, but we probably can think about our experiences with other providers. But I think what's really important and what likely will be a common theme with other genetic counselors you hear from is that we really try to make a genetic counseling session collaborative. It is not just a provider talking at a person and giving them a prescription of what they need to be doing to address their concerns or address the symptoms that they're having. So I really like to think of it as very conversational. I think many of us really try to understand from the patient's perspective what's motivating them, what are their concerns, what are their questions. And a lot of times those probably line up with some of the things that maybe you've gathered from their clinical history, and those are things that you wanted to address during your session. But there may be something you missed. Maybe your priority isn't aligned with the patient's. And so we really need to make sure we're listening very, very actively to have those conversations and to formulate our advice and our conversation based on their needs. So I like to think of it as reciprocal education. Your patient is constantly educating you. You can educate your patient. And it's, education from a genetic standpoint. It's probably been a while since many of your, patients have touched on chromosomes or genetic information. But it's taking it out of the textbook and really putting it into context of their life. How is this information impacting them? And putting it into a way that's understandable, but also allows them to make a decision about how this information fits into their life right now. So hopefully they walk away with a deeper understanding of how the genetic information or their clinical presentation, is affecting their health, but also a plan forward of what they can do with this information, understanding their options, and meeting those medical and personal goals.
Great answer. And I think that really goes for any patient session, regardless of the referral reason. Again, we see patients in diagnostic capacities and kind of, risk education and predictive settings. And that really still is the same takeaway is, empowering somebody to make a decision and understand what this genetic information might mean and might not mean for them, for their family, kind of big picture understanding there.
Great. Thank you, guys. My next question is, what type of team and supervisor relationships might a genetic counselor have once they're working?
Yeah, I can speak to at least what is in our capacity. So I'm more so on a clinical team, again, within the prenatal department. I think there can be a lot of different types of teams that you're on, depending on what hospital you're at. If you're in a clinical versus non-clinical role, you could be the only genetic counselor that's starting a clinic and really advocating for your role and utility amongst a healthcare provider or another type of team. For us, we have several different genetic counselors on our team. So it really is this collaborative relationship with the 7 or so genetic counselors plus our supervisor. So I really appreciate our department, and I believe a lot of other departments are like this, where it's constantly a learning experience being a genetic counselor. So it's so important to have very trusting relationships with the team that you're on. So you're constantly bouncing ideas off of each other, constantly getting feedback based on patient experience, medical experience. I think a lot of these clinical roles have case conferences, say once a week, where it's a collaboration with your genetic counselors, the physicians you work with. For us, our cytogenetics laboratory, to really foster that development and foster the best understanding of the clinical care that we're providing in order to provide the best care for our patients. So I would say a very collaborative role is what we see with our supervisors, and just a lot of learning, just constantly learning on the job. And there's genetic counselors who have been here 10 years and it's the same conversation.
And it's that understanding too that, you know, you have other people, whether you are the only genetic counselor or working on a team of 7 genetic counselors, the community itself also lends its expertise. There's so many ways that we can utilize listservs and resources to learn from each other. And I would add from, you know, our clinical team as well, we're not expected to be the experts in the IVF process as a reproductive genetic counselor. We're not expected to be the experts in obstetrical care for high-risk patients as a genetic counselor. And so it's leaning on and working with those experts, those physicians, those nurses, and together making a plan that meets all of the needs for a patient. So as Abby said, I think collaborative is a perfect word for it.
Mm-hmm.
Yeah, I work on a much smaller team. So there is one other genetic counselor in my adult genetics group that is kind of routinely seeing patients with physicians. So I think, you know, it's definitely the collaborative nature still applies. I work very closely with physicians, seeing, you know, patients in clinic, since a physical exam is kind of standard part of that process, which is a little different than prenatal and cancer and some similar areas. So I think that it really, that is a key word, is collaborative, you know, helping with the healthcare process, really making mutual decisions for what, you know, testing might make sense to offer the patient and talk with the patient about, and facilitate, you know, their decision-making process. I think, you know, our lane is a big one, and it can involve a lot of different things, but definitely there are other players involved and other people that we work closely with. I think that my role is sometimes a little bit different, or shifts into more kind of heavily educator role when I'm with non-genetics physicians, so endocrinologists, different specialists like that. I also work with non-physician healthcare providers, like a clinical pharmacist in pharmacogenomics clinic. So I think it definitely is, I think, a really great experience. I feel like I learn about other specialties that are outside of genetics, and get a lot of knowledge and experience there. But we are, you know, definitely a trusted expert in many aspects of, you know, different considerations. People really, I think, appreciate the leadership and really the clinical expertise that we have in those areas. So definitely, I think, a valuable member of the healthcare team. And also, you know, different relationships in kind of an academic or more of a research setting as well. And that's something that I, you know, find really exciting to learn more about. Definitely an area that is growing as well, and it is involved for a lot of genetic counselors who kind of, you know, play a role in the clinical and the research side of things. And there's a lot of different kind of mentorship or educational roles. We all supervise students and genetic counseling trainees, as well as medical students and genetics fellows, as well as pharmacy students for me. So a lot of kind of levels of students and people that we're mentoring, that we're supervising, that we're helping train, which is, I think, a great kind of role as well. We're all learning and we're all teaching. So, you know, regardless of who we are, I think there's a lot to learn and a lot to teach.
Great. Thank you all for speaking to that one. And I can definitely say, as a student, I've been welcomed with open arms by every genetic counselor I've talked to on an informal interview or shadowed. And I know right now with COVID, it's hard to find shadowing opportunities, but speaking to genetic counselors over the phone or by email has been a really great way to find out more about the field, and attending events like this one. So my next question would be, at present, what are some professional limitations that a genetic counselor might face?
Yeah, I'll take that one. So I would say the degree can be a factor. The fact that it is a master's degree in the healthcare sphere, there's MDs, PhDs. So there is going to be a natural hierarchy there. I think, and it's important, different institutions have different types of relationships and collaborations with your physicians, with your PhDs. So that is a factor that does come up. In other industries as well, I've heard the same thing about as genetic counselors transition into non-traditional roles, like business-related roles, not having an MBA, for example. So I still think people do pursue additional degrees when they feel like it's warranted, but that's still something that our healthcare field does have. The other thing I would say is genetic counseling is a newer profession. Even though we've been around for decades, it still is new in the scope of the healthcare setting. So I think a lot of times you're having to advocate for who you are in certain institutions or places, advocate for what you can do. That can be a very exciting opportunity to really start a cardiology clinic where there hasn't been genetics cardiology focus before. But in comparison to some other professions that might have unions or big advocacy groups, we're still working on getting our footing in some capacities as far as really showing our value.
Yeah, I think that is a great point, is that it's not always inherent, or it's not always accepted at face value that we do bring significant value. So something that we have to show instead of being in kind of baseline understanding. I think anytime a physician or other healthcare provider has worked with a genetic counselor, they get it, and they see the value, and they want to work with more genetic counselors. So I think that it's, we're pretty awesome, and definitely an asset to every area of healthcare, as well as other areas as well. But we're often the lowest degree in the room, or at a faculty meeting, or at a meeting with different professionals, or peers and colleagues in academia, or more the research side. There's almost always at least a PhD, and that everybody has except for me. And I didn't want to pursue an MD or a PhD. I could in the future, but I don't see that happening. I am done with school as far as I'm concerned. So that's, a choice that I feel very comfortable with, and I don't feel held back. But it's possible that, I would, or that people definitely, I think, do. So it's something that could be pursued for sure. I do think that sometimes ties into, depending on what a genetic counselor wants to do. So I am in partly research, partly clinical. If I really wanted to pursue only research or academia, it would be challenging, I think, especially where I am now. The Harvard system does not kind of even consider faculty positions for somebody without a PhD. So if I had a PhD in poetry, I would be eligible for faculty status in the role of a genetic counselor. But since our program or our degree doesn't have a PhD kind of level, that is a limiting factor. So other places that's not a factor for faculty, or faculty would be available for genetic counselors, but kind of varies. So I think it depends on where you want to go and what you want to do. It's always something that, again, you can add on. There are genetic counselors who do, PhD programs or other programs while also working as a genetic counselor. Some people go into, genetic counseling already having a second degree. So I think there are definitely options for whatever somebody wants to do, but yeah, it varies.
Great. Thank you for addressing the limitations, but also the opportunities that are tied with those limitations. And then my next question is, what is the genetic counseling field doing to address the societal emphasis on diversity, equity, and inclusion?
Yeah, so this is a really, I think, important issue for a number of different fields, especially in science and technology and healthcare. I think that we've been just looking at this Zoom FAQ session now. The genetic counseling profession is a pretty homogeneous one. It's primarily white, primarily women, and that has been something that we've been aware of for a long time. And I do think that there are tangible steps being made to address that at different levels. So one is in the programs themselves and kind of who is, learning about genetic counseling, connecting with programs, learning about this as a career option, and then pursuing it, by applying to programs. So programs are, I think, working to reduce or eliminate different barriers. So whether it's getting rid of the GRE requirement or, waiving fees or making it an option for students to have virtual interviews instead of needing to fly, around and visit programs in person. I think that those are very tangible steps. I think even just doing outreach to different organizations and different colleges that might be historic colleges of color, or more diverse, underrepresented, cities or universities is a good step as well. For this, GC Career Day event, we've tried to do that ourselves, and really trying to recruit and advertise to everyone, and different, not instead of just waiting for some people to find out about it and seek out opportunities like this. So I think that that's just kind of a frame shift of thinking about how, what can we do to build diversity and be attractive to underrepresented individuals. So that's an important thing kind of at the program level. The National Society of Genetic Counselors has made a big commitment. There's a task force, a DEI task force that's been created to really, figure out what are the kind of top ways that we can address this at different levels. ABGC, the American Board of Genetic Counseling, is also very actively involved. So they have committed to working with a third-party company, basically, to really address this, a consulting group. And there are different resources that are available. The Minority Genetic Professionals Network is awesome. They've been around for a long time and offer a lot of support and professional development resources for minority genetic counselors and other professionals in genetics that are underrepresented or of color. So I think that there are different steps being taken. I think it's going to be a long journey, and I think it's going to take a lot of work and commitment. I hope that there have been a number of conversations, I think, at the professional level, and I think we're getting there. I think it again is not easy. It's not going to be a quick solution, but I think people are really realizing that this is a problem and that we do need to change the way that we think about genetic counseling and who can be a genetic counselor and who should be a genetic counselor.
And certainly echo what Elizabeth is saying, how it's something we very much know is a problem, and we very much are working to address it, recognizing we still have a long ways to go. It is a multifaceted approach, from educating the counselors that we currently have through webinars and just really focusing a lot of initiatives on how can we foster just our own development. Also looking at who we have as genetic counselors. I think the programs have been doing a lot of thought as far as how do we reduce those barriers, those financial concerns getting into grad school? How do we actually create programming during graduate school to really focus on these issues? I can speak to, from a clinic standpoint, the type of things that we're trying to do, especially given our current climate, and that's really access to genetic testing, because traditionally that has been very much something that is attained by those who are more educated, those who have a better financial means. So as a clinic, we're really looking towards our community clinics, our individuals that maybe English isn't a first language, or individuals that the traditional scope of genetic counseling, our traditional institutions, might leave out. So really partnering with those clinics and those patients to see how can we make genetic counseling more accessible to everyone and make sure that we are offering the same level of testing to all our patient population. So I think that's a big focus for us, and really also educating ourselves as clinicians, because as patients walk in, we are, for the most part, white female, and what type of dynamic does that provide? So it's a constant work in progress, but it's not just educating genetic counselors, but also in the actions of our clinics. How are we giving equitable care to our patients?
Yeah, especially when those patients have, historically been harmed by genetics as a field, and definitely, I think being aware of that, and as genetic counselors, knowing that history is so important to then, make the change, and
Mhm.
understand where a patient might be coming from or how they might react differently.
As well as the actionable steps that are being taken now and that can be taken in the future. So now we're going to transition a little bit from GC as a profession to talking about what the genetic counseling training program looks like. So a very broad question, but what do the 2 years of training typically entail?
Most important question, probably, as people are getting ready to decide if this is something they're willing to participate in over the next 2 years. But no, I mean, graduate school is a time of lots of learning, and also balancing that learning with the life that maybe you've already established. Like lots of us said, we had careers in a way before we went back to grad school. Some people transitioned straight from undergraduate. But it is accessible to wherever you're coming from, to hopefully transition into this sphere. So the 2 years of training have pretty key components. So obviously didactic work is huge. It's really allowing you to gain advanced and specified knowledge in genetics and genetic testing technologies, in the history of the field, building those psychosocial counseling skills. It is working on case studies. So didactic work is absolutely a key component of it, and a very necessary component. Like we've highlighted, the field is always changing. So the didactic work that the three of us have experienced likely will be different than the didactic work that's being put forward by programs now. And I think that's an exciting testament. So you don't want my slides from a few years ago, because yours are going to be even better. I think another key part is the clinical aspect, right? This is the most important. And I think the clinical aspect starts truthfully as early as the first few weeks. And whether that be through observation, whether it be through having patients come into the program or speak about their experience with the genetic counseling field, and then of course more tangibly with your clinical rotations. So I think every program has the opportunity and the necessity to provide counseling experiences for students. And so typically you're working with a supervisor or multiple supervisors, and tiptoeing your way into really feeling out that role of an independent genetic counselor in a very safe way, right? You have a professional with you. You have someone who has your back. If all of a sudden you forget what recessive versus dominant inheritance is, it happens. But it's really a key way for you to develop those skills that are really required and part of being a genetic counselor independently after grad school. So I think most programs will have at least 3+ rotations. So you have a rotation where you're experiencing prenatal or reproductive genetics. You have a clinical experience where you're working in oncology genetics, and then also where you're working in general or pediatric genetics. Of course, there are many different flavors to other rotation opportunities, but those are typically the core components. And then I think there's also probably a research component to it too. I think most programs have implemented a capstone project where students are encouraged to find an area of genetic counseling, or a tangential area of genetic counseling that they can focus a year-long research study on, whether that's engaging a specific patient population or exploring genetic counselors' views towards a certain aspect of the field. And so I think that's important to really, one, emphasize the learning aspect of genetic counseling, but also to practice getting the genetic counseling voice out there. We want genetic counselors to publish. We want people to know the work that we're doing. And so I think that that's a pretty consistent component of the programs too. So didactic, you can't get away from it. It's school, it's important. Clinical is obviously the hardest you'll ever work, but the most rewarding. And then of course that research aspect in highlighting the learning of genetic counseling as a whole and growing the profession.
Wonderful, thank you. The next question is particularly pertinent for me, and I'm sure for many people listening into this. How can I determine which genetic counseling program is best for me?
This is a good one. There's no right answer. And I know I'm jumping in on all of these because it's a little bit more recent, I guess, for me. But I really encourage you to find each program's unique flavor. So every program is going to offer the things that I just spoke about: didactic, research, clinical. But they probably do it in a different way. So I encourage you to think about what makes a program unique, what makes a program different, and how does that uniqueness fit your goals as a person, professional, etc. So, maybe you did a lot of community-based work before you enter the field or consider the field of genetic counseling or graduate school. And maybe you want to continue that work. So maybe you look for a program who has really clear diversity and inclusion initiatives, is working with primarily community-based hospitals as their rotation sites. And you can continue that journey from one area of your life to the next. Maybe you had a really strong advocacy experience working more so in populations with individuals who have different needs or special needs before going into graduate school, and you feel like you've honed a lot of those maybe more psychosocial and counseling skills, or have practiced those more so before entering the field. And maybe you choose to focus on a program that's going to really challenge your research and your critical thinking. And maybe there's a program that has a stronger focus on research than another. And you may, want to go to that program so you can grow those skills that maybe you haven't had as much experience with. So I think, find something that makes the program unique. Of course, there are going to be logistical pieces that add to this, and hopefully someone else can maybe add some of the things they think about when they were applying to programs. But I think do the research, find out about the program. Don't just read the first page about the program and when it was established. Go deeper. Find out who the students are. Find out what the initiatives are, and get that unique flavor that fits your goals too.
Yeah, I'll definitely echo a lot of that sentiment in really figuring out what meets your goals and then what's unique about the program. I think it's really important to think through and write it down and think of components of what is important to me in a specific program. Is it the size of your class? Do you want a smaller class size versus a larger one? Do you want only genetic counselors in your classes versus being with medical students as well? Is cost really important to you? Because there is a variation in cost between a lot of these programs if you're going to a private school versus a public school. I think it's important thinking what city and rotation opportunities are really important to me. Where do I want to make connections? It doesn't mean you need to stay there. We had plenty of people in my program who went back to the state they were from, but really thinking through those considerations as well. And then for things like, I guess for me, really working with a diverse population was very important for me based on my background. So I was really looking at programs that emphasized that and had more opportunities in community hospitals or a really diverse setting. So that's an example of really finding what's important to you. And then really researching what is unique about the program. Then all these programs start running together. So I think really holding on to that feeling of how did you feel when you were walking away from the program, when you were talking to the students, what did you feel about their experience? Did it match what you were looking for? What was that feeling when you talked to the faculty? Really remembering that when you're trying to differentiate all the programs that you went to.
I think they're really good answers. As the old timer of the group who graduated 5 years ago, there were definitely fewer jobs back then, I'd say, or it wasn't. Now there are so like everyone wants and needs genetic counselors. Again, great reputation. We're all the best. So I think that that's been really exciting to see that kind of skyrocket growth. But it wasn't quite as high when I was graduating or applying. So I think often people were considering, you know, where do I want to be working eventually? And that was a factor in choosing a program, just because that was where you naturally would be making some connections. It wasn't for everybody, but it was a factor. I think now, especially, that is much less so. You know, Abby and Megan highlighted it great, and that a lot of people, you know, are looking for maybe a new experience and they want to spend 2 years living somewhere completely different. So I think that that's less of a factor, kind of a, you know, major, you know, implication of your whole career depends on this or anything like that. I think, you know, it's relatively competitive. So I think it's great to cast a wide net, kind of see what programs you click with or, you know, really enjoy if you visit, or if you know, look into it more, you know, have virtual interviews, you know, informational interviews with students there, that kind of thing. I agree that different programs might have different characteristics for what the medical kind of facilities are like. Is it rotations at multiple different hospitals or like one institution? That kind of thing. You know, are medical students also kind of part of the courses? Those are all great points that were brought up. But yeah, I think there's not always a major difference. It's really, you know, what kind of class size, maybe what city, what experience you're looking for, and then just, you know, hopefully matching.
Awesome. Now, speaking to that matching process, can anybody talk a little bit about it and how it works?
Yeah.
Before my time, so I'll turn it over to these two.
So we were actually the last class that did not have to do the match program, but luckily for you guys, there are so many different resources online, or any program or current GC student will talk about it. And that's where I got a lot of my information from. But it really is this automated system that pairs students and programs based on their individual rankings. I think one important thing to highlight is it really favors the students' rankings. There's a statistic that out of the top 3 schools that you rank, 95% of individuals will get their top 3 choices. So when I was speaking with program directors about this, they really emphasized to only rank the ones you're really considering because of that, or just be thoughtful because 95% will make it into their top 3. There's
students who match, right, Abby?
Yes. There's a wonderful video through natmatch.com that actually is doing the matching for GC admissions. So it's natmatch.com/ or that thing, GC admissions. Yes, / and then algorithm. You can Google it. That's what I did. And it really goes through what their actual algorithm was. But I will say, comparing with students that actually use the match program, I think they were really happy with it. It removes, we used to have some people on a wait list, and it was a couple days endeavor to really figure out where you were going based on who was dropping off the wait list. So now it's one day, one email, I believe, and you know exactly where you're going, similar to how it is for residency programs for people graduating from medical school. So a lot of positive experiences, but a lot of resources online. That is my understanding thus far.
Great, thank you. And we're going to close today with one last question. What are some of the things that make an applicant competitive for programs?
The most important question, right? I think you can be creative with this one, right? All of us are coming at, you know, this field and a desire to be a part of this field with a different background, whether that be in what you did before graduate school, what you've done throughout your whole life, what are your goals, your motivations. So I encourage you to really have that narrative down pat going into this kind of application process. So, you know, be creative about the definition of a genetic counselor. Yes, there is genetics and science, we likely all can highlight that we have a passion to be in that type of field where we're working and continuously learning. And, yes, there's the counseling side, there's the people side. I am guessing many of us have come into this program or the application side of things, having counseling experience or working with a crisis hotline. And so it's really taking your experiences and finding something that maybe goes beyond those. Maybe it's in your life experiences that can connect all of them together to say, look, this is something I've been, really advocating for throughout XYZ steps of my life. And I think that genetic counseling meets me where I am with my goals and challenges me to develop those, over the next 2 years. And so to provide perspective, if any of that was not clear, I really have a passion for patient advocacy. So I, throughout my life, have been a dance instructor for individuals with Down syndrome and other varying needs. And that's something that was extremely important to me. But I also knew that I was not going to be a dance teacher for the rest of my life. I'm not that good. But I really wanted to kind of engage that people knowledge, that person-focused knowledge, and grow it with kind of a field that I could continue to work with patients in this person way. And so I really used advocacy as my common theme to say, I know I want to be a genetic counselor. This is why, and use those experiences to highlight the definition in a new way. So find something that's unique. It's not to say the shadowing experiences are not valuable. They're extremely valuable. Just find something that you're passionate about and let it show.
Yeah, I think all of that is really important. And I think exactly to Megan's point, having a unique narrative of why, of who you are, genetic counseling is getting increasingly competitive, and a lot of people are going to have a lot of similar experiences. They love science, but didn't want to be a doctor or go into the laboratory. They like helping people. It's can almost be cookie cutter or stereotypical. How are you different from that? And really utilize that, as Megan was mentioning, to really weave your narrative and your personal statement in your interview, so they really walk away knowing who you are, versus what's just on your resume, what boxes you were checking. I think advocacy is a great one. For example, I came from a very non-traditional background where I did a lot of work in insurance billing, and how had those experiences really shaped me, or a lot of work with the homeless population, and what did that mean to me in comparison to genetic counseling. So it's really finding your narrative and how you are different. I will also say, and I think we've touched upon this in other questions, when you're applying to different programs, actually apply to different programs. I think it's really important, and the programs will appreciate you highlighting what's unique about their program and really tailoring your application to that, not just a generic personal statement that you're mass sending out in hopes that you're going to get an interview. It's really highlighting why that program is unique, because they put a lot of work into differentiating themselves from other programs as well.
Yeah, that's definitely a great point. And usually most of the programs, I think, have a question about, why X program, along with the personal statement. So those both matter. Think about them both. I think that these have been some great points made. I feel kind of redundant saying the same thing, but I do think that it's, I think a lot of misconceptions about, what should students do, especially if they're interested in coming straight from undergrad or don't have, kind of a professional work history. So I went straight from undergrad to graduate school for genetic counseling. My background was, I'd say my kind of special sauce or unique aspect was I worked as a hospice volunteer in high school. So I worked with people who are terminally ill and essentially actively dying. And that was a unique experience, and I think a very important experience for me when I was younger. I think a lot of people feel like they need to have something on their resume that says genetic or, is very directly relevant to counseling. And it's like, that is the name of, our job, genetic counseling. But as we have talked about, I think there are so many different roles: education, advocacy, as Megan's mentioned. So I think there are a lot of ways to find directly relevant skills to genetic counseling that have nothing to do with genetics and don't mention counseling. Like, what high school students or college students are going to get a job as a counselor? Like, it's, there are different opportunities for counseling skills, but in terms of like professional experience, it's not always doable. It's really difficult to get direct shadowing experience with the genetic counselor. Informational interviews are great. You don't need to have actual shadowing. And not everybody can take unpaid internships to, have this experience that might look great on a resume, but that's not doable for everybody. So I think you can find a lot of opportunities to, tutoring is education. That's very relevant. Working with different diverse populations, whether it's in the disability community, or, lower socioeconomic incomes, or, needy populations like the homeless. These are all ways to interact with, advocate for, learn from, and hopefully benefit, different groups of people, which is really what genetic counseling is about, is advocating and educating is a huge part of our roles, regardless of the setting that we're in. So I think just remembering that piece of it, you can apply that in so many different ways, beyond just being in a lab or, having a crisis kind of counseling experience. So really, following your passion, whether it's dance, whether it's something else, hanging out with old and dying people after high school, whatever it is that you find and you really, have a positive, meaningful experience from, that's going to come across and be special.
Mm-hmm. Great. Thank you so much, Megan, Abby, and Elizabeth, for taking the time to answer these questions and to share about your experience as genetic counselors. As you wrap up, are there any concluding thoughts that you'd like to share?
List this career day on your resume.
Yeah, it's true. That's true. That's an experience, having the opportunity
Definitely.
to hear from us and hopefully in the live components interact with us and, put it on there and don't hesitate to reach out to the genetic counselors in your area or find us on LinkedIn. We're generally very approachable people, but you've got this, go for it, full speed ahead. We'll be thinking about you.
Good luck.
Good luck.